Hello, Dr. Mona. How are you doing?
Fine, thank you. Hello and namaskar to everybody.
Dr. Mona, you have the experience in handling coronavirus cases in the US for more than a year. Can you please talk a little bit about your experience?
Definitely, certainly, sir. So coronavirus came to all of us as a surprise last year. It created a lot of fear and havoc all over the world, as we know that. But it also taught us a lot of things. Having treated patients who have corona, we have eventually learned that it presents either as mild cases, moderate cases, and then eventually it progresses. In certain cases it progresses to severe, and that's when it really takes a bad turn. Having described this as mild, moderate, and severe, we can go into the stages and how we treated those patients and take it from there.
Okay, certainly, we'll get there. There's a lot of information available out there about the evolving virus, and most of our audience is aware of it. But the challenge we face in the current critical situation in India is what decision to make and how to act appropriately and in timely manner, which can save lives. Every action we do or we don't save lives. So let me ask you those crucial questions, which are very important for a common man to correctly act. What are the alarming signals for a patient to rush to hospital with or without oximeter?
The alarming symptoms would be if they are coughing, and with the cough, they develop shortness of breath and a chest pain, either in the front or the back of the chest, which would prevent them from taking a deep breath. If they have continuous fevers and if they are feeling short of breath, even walking to the bathroom or doing any kinds of activities of daily living, that is when I would really want those patients to get attention, to go out in the field, to go out to the hospital and get them checked out.
That's a very important point. And being aware of these alarm signals and acting on time is a very critical thing that any of us can do to save lives. Now, Dr. Mona, what is the duration for a mild to medium to severe progression?
So here I would like to elaborate a little bit more.
Sure.
When the case starts and which is considered mild, you may develop the symptoms within 72 hours of exposure. When patients will start developing, fever that come usually in the evening or they come at certain time of the day, and they will get chills. Even if they don't get fever, they will experience like a shiver or chills in their bodies. They also may come down with a headache, severe headache, usually related to severe gastric symptoms that are created because of the virus as it passes through the GI tract. And at that time, they may not have like a runny nose, a nose block, or irritation in the throat, which is also known as sore throat. Patients may feel that, oh, I have something going on in my throat. It's not the same. And as time progresses, most young people will be able to, young and old will be able to overcome these symptoms or just continue to experience them. But patients specifically with uncontrolled diabetes, transplant patients, cancer patients, or patients who have other comorbid factors like renal failure, they are hypertensive with a poor heart condition, they already have an existing heart condition in terms of congestive heart failure or cardiomyopathy, which is when the heart muscle has become weak and it's not able to pump out enough blood into the circulation. So at that, those are the patients who usually are not able to handle it. And those patients quickly, within 3 days to 4 days, progress into a moderate case. Because this virus also causes blood clots, if they don't keep up with their fluid intake, okay, a virus consumes a lot of fluid in their body. As a result, the blood becomes thicker and then they start forming blood clots. When they start forming blood clots, at that time is when the myalgia or severe body aches start happening. They complain of severe body aches, weakness, and they also start developing cough. Usually cough is the beginning of mild getting into the moderate stage. And this cough can be two kinds. Either it causes just inflammatory process in the lung, or it is causing blood clots. As a result, when they try to take a breath, the lung cannot expand because that part of the lung is almost dying and it's not getting enough blood circulation. As a result, they will develop cough, and they'll tell you, they'll say, oh, I get this dry cough. They're not able to bring the mucus out. They feel that something is stuck either in their throat or in the back of their chest, and they go into a coughing spell. Usually it is this stage when patients start panicking, but this is the time when they should not panic. And what the people in India definitely need, from what I'm seeing, is they need a lot of mental health support. They need somebody to tell them that, fine, take deep breaths, do pranayam, do breathing exercises, so that you can overcome this by yourself and continue drinking enough fluids and stuff. So within 3 to 4 days, you're entering into a moderate state. It is this moderate state, if it is not taken care, meaning patients are not seen, examined by a medical facility, is when it really, really progresses. That's when they start desaturating. By the 5th to the 7th day, usually we have found when they progress into the last or the progressive state, okay, which is the severe form of the virus affecting them.
Wow. That was a clear and very explanatory information, Doctor. Thank you. Let me get to the next question that I have. Now, if it is like one of my relatives who gets symptoms, should I rush to COVID care center? What should I do to make sure that I don't infect the rest of the family?
Sure. Sorry about that. As long as you keep a 6 feet of distance and wear a mask, you are really not going to get affected unless you yourself have other comorbid disease. Usually what we have seen is, husband and wife living in one room, or if there are 8 people living in one room, that is when you need to start getting a little careful. Keep your utensils separate, keep your glass and spoon and plate separate, wash your own utensils by yourself. The food can be made by one person, and it really should not spark like a fear that, somebody else in the family has COVID and I need to run away. In fact, what we have seen is the family support is very, very needed at this time. So if you're in the same place, at least there is a moral support. And especially the person who is affected by the COVID disease, they see their family members, they at least feel I'm seeing them, they're not feeling isolated, their fear factor is at least manageable. So unless you feel that the person is coughing too much, or having high fevers, and you have to come very much close in contact with them, those are the times maybe you can ask this patient to go into the hospital. But for your own sake and for the other family members, you get it checked, you probably get a COVID test done, but you really don't need to rush into a COVID care center.
Okay, thank you. This is a very important information, that we should not panic, and also the family support is very important for the patient. So that was a very good piece of information, and I think that will help anybody who is supporting some patient in the family, and the patient really needs your support. So please do not panic and follow what doctor has said. Now, having said that, I want to ask you, are the kids susceptible to the new strain of coronavirus?
Thank you for asking this question. We have started seeing COVID-19 or COVID cases in kids and under the age of 10, especially in the Uttarakhand area. What we found that it is possible that in that area there was water contamination leading to a lot of these kids getting affected. Overall, in other areas, so far we haven't seen kids. We have seen some kids in remote areas who were affected if they had either sickle cell disease, or where the chances of blood clotting were high. Then they have developed certain neurological symptoms also. We've also seen this in certain hemoglobinopathies and patients with leukemia or lymphomas. Coming back to the kids that were diagnosed in the Uttarakhand area, more insight has been taken, details of the case history has been looked into to find out what was the cause, water being one, but if there was any other family association or those kids, if they followed the same schools, and that's what was leading to them having a higher incidence of acquiring this disease. So hopefully in a day or two, we should have more answers.
Okay, that was insightful. Yeah, that is evolving information about the situation of Uttarakhand. I think we'll come to know in few days, like the doctor said, what exactly is the reason. Now, I have a question that if I'm infected, what are the actions that I should do? And those are the immediate actions that I can do.
Absolutely. So once you are infected and you find out that you're positive, or you start developing the symptoms and you suspect that you probably may have the COVID-19 disease or got affected by it, start isolating. Start with isolating yourself, keep your utensils and glass and spoons separately. Keep a distance of at least 6 feet, wear a mask continuously. Hydrate yourself. Very, very important to start hydrating yourself from 3 liters to 4 liters a day. Exercising, because exercise releases certain endorphins, and those are vital hormones. They will prevent your muscle from getting tiring. Once those muscles don't tire out, then you will be able to produce enough energy in your muscles to keep up with your breathing needs when and if any case, if the disease is progressing. The other things we are trying to tell patients is avoid alcohol at any cost. Please do not drink. Also avoid, even though we recommend a high protein diet, avoid too much greasy, fatty foods. And any meats that involve grease or fat, fried foods. Eat a healthy diet, more liquids, more soups, fruits and vegetables, so that you get enough of the vitamins in it. And do exercises in terms of pranayam, kapalbhati. You can follow any YouTube guidelines for yogic breathing exercises, and take it from there.
Okay, so like doctor said, this is primarily infecting lungs, and if you can do any kind of breathing exercises, that would help.
Along with breathing, it is overall muscles are also getting involved. So walking, definitely walking. You don't have to run or jog, but a 10-minute brisk walk or a 15-minute brisk walk. If you lay around, is when the muscles become more weaker. Okay, and that's when you will get into more trouble, because if they become weak, then even little bit of activity is going to make you feel, oh, I'm very weak, and I'm short of breath, because then the fear and the anxiety kicks in. So walking is a perfectly simple and a good exercise also.
Okay, that's great. That's great. I have one other question, which is, what are the life-threatening symptoms? We are hearing few perplexing cases where people are normal and suddenly oxygen levels drop and they die within few hours. How can we be vigilant to avoid such unfortunate situations?
So thank you for asking this question. The most important thing you'll see is a cough, a relenting cough that is not going away. They have a chest pain or a back pain. That means what is happening is they look fine, blood pressure, vitals may be fine, but there may be a relative drop in blood pressure. If somebody's blood pressure is hanging around, say, 130s, 140s, and now you see a blood pressure of 110, people are thinking, oh, it's normal, but it's not. What they are developing is a large clot in the central part of your vessels, which supply blood to the lungs. And that is the most dangerous one. You can collapse in like no minutes. Okay. And that is when they're having bad outcomes. In certain cases, we also saw that plasma therapy causes seeping of this fluid into the lungs, and the lungs become more thicker and less flexible. The lungs are like grapes, you can expand, you can close, you can open like that. So once they get filled up with fluid, then you have kind of lost the battle. So try to prevent that. Also, what we are observing from all these case studies, Dr. Agarwal, who recently we lost, he is a primary example where he had pleural effusions. He had water collecting by the side of the lung, which is, water is such a solid thing, the lung cannot expand. So slowly your capacity to breathe goes away. And while we know that definitely COVID causes large blood clots and small blood clots and multiple blood clots, it can also cause and affect your heart. As a result, you tend to seep water into your lungs and the lungs become stiffer. So try to be vigilant there. Look into other causes besides the blood clot that could be causing the lungs to get stiffer. They will usually at that time say that if I get up from a lying position to a sitting position, my oxygen drops. Or if I move from my bed or get up and walk a little bit, my oxygenation drops. Those are the factors when you really have to closely watch them, push them to do exercises, assess whether they have any other heart conditions. And the other thing we have seen in patients who are diabetics, because they cannot keep up with their water requirements. So after meals, we have seen sugars of 300, 400. The sugar molecule is a bigger molecule, larger molecule. It draws water with it. So body tries to dump this a larger sugar molecule through the kidney or through your GI system, but it also draws water at that time. So the patients become dehydrated because water is getting cold. And if they don't maintain this fluid intake, they will feel they have a dry mouth, they have a bitter taste in the mouth, they start feeling more weaker because they are producing more ketones in their body. And their urine may smell. Those are few of the major symptoms. At that time, they need to really keep up with the fluid intake, take low carb diet, or just go on liquids mainly. Sugar control at that point also becomes very important.
Okay, doctor, that was quite insightful. Considering the current situation in India, I want to know about these scarcity elements where steroids, oxygen, remdesivir, we want to know at what times are they really needed to a patient.
So oxygen, of course, oxygen and steroids would come into moderate phase. You do not need them in the initial phase. Even remdesivir, we are now pushing it, at least in US, we have been trying to push it only to very severe cases where nothing else has really worked. Then yes, we want to try and give it to them. The way it should be taken also is different. 7 days of treatment is being given in India. That's where you're using up resources. If you don't see a response within 3 days, you can kind of back off, use it for another patient who really needs it. The same goes with oxygenation. If your oxygenation is hanging around 92, walk them, make them do breathing exercises. You really don't need to supplement oxygen at that point. Use it for somebody else who really needs it more. Steroids, basically, it's case by case basis, but once they reach that moderate stage, somewhere around 5 to 7 days, if their lung symptoms becomes really bad, if they were smokers, if they develop airway disease, like a reactive airway disease, at that point, definitely right away start them on steroids. But the key is do not keep them on high dose steroids because of the side effect that it brings. It brings psychosis, it increases the anxiety of the patients, then they start panicking. And because of the panic itself, we are so powerful as human beings to be able to control our airways. And psychologically, we can actually, create a phase where we are kind of decreasing our airway size. And as a result, panic should not occur. We should avoid that phase. But start steroids, assess it daily, by the second, third day, if you feel it has made a difference, you can start tapering, because it has already made a difference and it's going to stay in your system. It has a good half-life, and you can use them in other patients who need it.
Thank you so much, Dr. Mona. This was quite insightful and very useful, to the point, and I'm hoping that this information is very useful to the audience and they can act appropriately based on this. Um, Signing off, Venkat Reddy Kotta, Mana TV and Mana TV International.
Thank you very much for having me, and I hope I can make a difference.
Thank you.
Thank you.